Laser treatments, YAG plus SMA for long non-healing wounds due to immunodeficiency. Dear colleagues, allow me to thank the organizing committee. This is the third time I'm attending the conference, the third time I'm here with presentations on our subject, treatment of long-healing wounds with the help of an erbium laser. Despite the large number of publications available, the topic of wound healing remains very relevant. This is connected not only with the problem of when it is impossible to eliminate the cause of the formation of chronic wounds, but also with the fact that it requires large expenses for treatment and social rehabilitation. First of all, let's define the terminology. Low-intensity laser radiation and high-intensity laser treatment. Low-intensity laser radiation is laser radiation that can be compared to the solar radiation that penetrates the skin on a sunny day. High-intensity laser treatment can cause destruction of the biological tissues. In other words, these are surgical lasers. There are many definitions of long-term healing wounds. Without going into details, I will say, if the wound has not healed within 4 weeks, it is necessary to clarify the cause. And if the wound did not heal within 6 to 8 weeks, then it can be called a chronic or a trophic ulcer. What can delay healing? Firstly, this is a background disease, for example, diabetes. It can also be the formation of a microbial biofilm, antibiotic-resistant microflora, which is in the wound, allergization, fibromic changes, and disorders of the immune system. Not all of these causes can be eliminated at the stage of wounds. Violation of the immune system occurs in a variety of pathological conditions. Severe disorders occur when using many drugs, but in some cases, it is impossible to do without them. There is a large number of studies proving that wound healing is slowed while taking immunosuppressive drugs during transplantation of solid organs, such as liver, kidneys, pancreas, with systemic diseases, and with oncological pathology. Based on international protocols, many principles of the long-term treatment healing wounds are distinguished, but I will not dwell on them. I will emphasize only that if within 4 weeks, in accordance with the protocols, we are not able to heal the wound, it is necessary to take measures to stimulate reparations. Various factors can be applied here, including laser technology. Note that often the choice of funds is not based on evidence-based medicine methods, but according to experts, this is possible. With regard to laser methods, with low-intensity and high-intensity laser radiation, low-intensity laser therapy for wounds has shown to be effective, including with a combination with photodynamic therapy. In our studies, we used the radiation of an erbium laser, the absorption peak of which falls on water. The wavelength is 2.94 micrometers. An important aspect is that the laser beam cannot be transmitted through the fiber. It is only in the direct field. If the wound has pockets, then we cannot handle it. When absorbed by water, the radiation of an erbium laser surpasses a carbon dioxide laser. However, its radiation is not absorbed by those chromophores that we use in surgery, such as hemoglobin, carboxyhemoglobin, melanin. In order to explain the effect of radiation from an erbium laser, one must remember that exposure to high temperature causes various disturbances. Up to 45 degrees Celsius are reversible violations. Then, in order for us to evaporate the tissue, we need 300 degrees Celsius. When exposed to a temperature of 150 degrees, tissue carbonization occurs. The erbium laser unit allows energy to be supplied in such short intervals that are shorter than the thermal relaxation time. Therefore, we will vaporize the tissue and will not damage the underlying tissue. You see the microphoto I made. One flash of an erbium laser, vaporization depth of about 50 microns. You see bleeding microvessels. There is no coagulation. These are healthy underlying tissues.
Разработанный на основе лазерного эрбиолазерного излучения метод стимуляции и репарации основан в том, что луч лазера, как
Based on erbium radiation, a method of stimulation of repair has been developed. It is based on the fact that the laser beam is divided into small rays, the figure on the left. There are about 6,000 to 8,000 of them.
То есть никаких повреждений кожи не происходит. Но в глубине эти лучики эффект акустический.
See how it looks when magnified on the skin. There is no damage. In depth, the acoustic effect of the rays is summed up and stimulation occurs. We annually explain this mechanism at such meetings. I will not dwell on it. I can only say that this effect is called the SMA effect, and the technique that is used today in aesthetic medicine is called RecoSMA. Large experimental studies were carried out, including using light and electron microscopy. In the experiment, there were participants with various injuries: patchwork, thermal, linear, neurotrophic. The rate of wound healing, the rate of epithelialization, that is, the reduction in the area of wounds, and the timing of complete healing were evaluated. There were control groups.
И в результате мы получили очень хороший ответ для стимуляции и репарации при различных видах ран, даже при
As a result, we received very good answers for stimulating the repair of various types of wounds, even burns, when we applied the SMA method. We did not receive healing acceleration because it is impossible to accelerate the process of cell division. We got good healing without scarring the underlying tissues. This method also performed well on neurotrophic ulcers.
Очень хорошо показал себя на нейротрофических язвах.
The Ministry of Health of the Republic of Belarus in 2018 approved our developments in the form of instructions for the method. This allows for the use of this method not only for the purpose of scientific development, but also in all organizations of our country. A clinical study of the developed method, after approval by the Ethics Committee, was carried out on the basis of the Department of Transplantology in the 9-city clinical hospital of Minsk. Today, it is the Minsk Scientific and Practical Center for Surgery and Transplantology. We were shooting. See how fibrin plaque looks at high magnification, and a few laser flashes. The wound is clean, without burns, without coagulation. Since 2003, 204 patients with various localization of chronic wounds have been treated. I will give clinical examples. Most of all, there were patients with trophic ulcers of the lower extremities. There were almost 100 of them. In the top picture, you see a patient who has cirrhosis. She had secondary ulcers that did not respond to treatment. After 1.5 months, we got a good result. Bottom shot, the results of the treatment of venous trophic ulcers. Another trophic ulcer in the upper left picture. It is very extensive with stitched bleeding vessels. On the right, you see a reference shot taken 2 years later, 10 a.m. Wounds of the anterior abdominal wall were observed in 41 patients after a variety of interventions. In the picture, you see a wound after abdominoplasty in a patient with a large body weight and diabetes. With regard to long-term non-healing wounds after transplantation on the background of immunosuppression, there were 18 such patients. with the improvement of immunosuppression or reduction of dosage, with the improvement of surgical technology, while reducing the traumaticity of these operations, the use of preventive measures. All this does not completely avoid healing. You see the patient after a liver transplant. His wound did not give in to healing. The picture shows our work in the operating room, how we treat the wounds. Processing is carried out in the intensive care unit, left picture. The last picture I want to demonstrate to you was taken on Friday before leaving for the Congress. It shows a patient from Japan. She underwent a second liver transplant. The autoimmune process affected the liver and healing went very poorly. With systemic lupus erythematosus, drugs are used that inhibit the immune system. First of all, these are steroid hormones, cytostatics, etc. In the pictures, you see the results after the laser procedures. These are different patients. In this picture, you see patients with trophic ulcers with systemic sclerosis on the anterior surface of the lower leg, on the lower third of the lower leg a circular ulcer, and on the fingers. All this is effectively treatable. In the picture, the patient is an 8-year-old. She has an oncological pathology. She underwent surgery for mesothelioma. She had a cut from the xiphoid process to the navel, and to the left and to the right. It did not heal for a long time. Children's surgeons recommend a second operation with suturing, and then a course of chemotherapy. We carried out treatment and the wound began to heal. The only unhealed area is the ligature fistula. Before going here, I deleted it. Pressure ulcers respond to laser treatment. We got good treatment results in accordance with the liver transplantation. There are cases when there was no result. There are points of no return when it is impossible to treat, because there comes the decompensation of all organs and systems. In this case, not only lasers, but intensive care methods do not help. With the kidney transplantation, we have achieved complete healing. This is due to less aggressive immunosuppressive therapy with smaller wounds. With systemic diseases, the patient died of thromboembolism. This did not happen in our hospital. She was urgently hospitalized in a hospital with a hip fracture. Thromboembolism occurred. I want to conclude. Laser ablation in combination with stimulation of repair by the method of spatial modulated microdestruction of biological tissues is an effective method of rehabilitation and repair of long-healing wounds and trophic ulcers. With its help, it is possible to remove non-viable tissues with visual control, achieve sanitation of the wound surface after 1 to 2 treatments, prepare the wound for secondary suturing within 7 to 10 days, and stimulate the repair of long-healing wounds against immunodeficiency. The method can be used as monotherapy or in combination with other methods. Thank you for your attention.